Heart disease kills more women every year than all cancers combined. Not some cancers, all of them combined. 1 in 3 women in this country dies from cardiovascular disease, and most of them never saw it coming because nobody told them that the hot flashes they were having years earlier were their body trying to send a message about their heart. I want to talk to you today about what is actually happening inside your blood vessels every time you have a hot flash. Not what it feels like, what it is doing, because the research on this changed how I think about everything, and it will change how you think about your symptoms. If you have hot flashes, frequent ones, early ones, severe ones, stay with me until the end of this video, because what I am about to tell you is something your appointment almost certainly never covered. My name is Nora. I spend my time going through peer-reviewed research on hormonal health, the kind that takes years to reach your doctor's office, if it ever does. What I am sharing today comes directly from some of the most important cardiovascular research on women published in the last decade. This is not opinion. This is what the data shows. And before we begin, stay with me until the end, because I want to share something I have been building quietly for women like you. 4 things today. What hot flashes are actually doing inside your blood vessels. Why the timing of your hot flashes matters more than most doctors know. What the SWAN Heart Study, one of the largest cardiovascular studies ever done on midlife women, found about the connection, and what you can actually do about it. The 4th thing, what to do, is the part most videos skip. I am not skipping it. One question before we start. Leave it below. Have you ever had a doctor connect your hot flashes to your heart health? Yes, no, or never even came up. I want to know how many of you have had that conversation, because I already know the answer, and it tells me exactly why this video needs to exist. Most women think of a hot flash as a temperature problem. The body overheats, you sweat, it passes, that is how it feels, but that is not what is happening. A hot flash is a vascular event. It is your blood vessels rapidly dilating, expanding, in response to a signal from your hypothalamus. The same hypothalamus that controls your body temperature also controls vascular tone, the tension in your blood vessel walls. When estrogen declines, the hypothalamus loses one of its primary regulators. It becomes hypersensitive. It misfires. And here is what nobody tells you. Every time that misfiring happens, every single hot flash, your blood vessels are going through a rapid, forced dilation followed by constriction, over and over. In women who have frequent hot flashes, this is happening multiple times a day, every day, for years. Now here is the part your appointment almost never covers. Your endothelium, the single layer of cells that lines every blood vessel in your body, is responsible for keeping those vessels flexible, responsive, and clear. Every time a hot flash forces a rapid vascular event, that endothelium experiences stress. And when this happens repeatedly, over months and years, something measurable begins to change in the vessel walls. American Heart Association: 1 in 3 women die from cardiovascular disease, more than all cancers combined. Heart disease is the leading cause of death in women, not breast cancer. Heart disease, the study of women's health across the nation, called the SWAN Study, is one of the most comprehensive long-term studies ever conducted on women going through the menopause transition. Thousands of women, multiple research centers, years of data, and one of the most important things they found came from the SWAN Heart Sub-Study, which looked specifically at the cardiovascular health of midlife women. What they found was this. Women who reported hot flashes had measurably lower flow-mediated dilation compared to women who did not have hot flashes. Flow-mediated dilation is the medical measurement of how well your blood vessels expand when they need to. It is the gold standard marker of endothelial function, how healthy the lining of your blood vessels is. Lower flow-mediated dilation means the vessels are less flexible, less responsive, and that is the earliest measurable sign of cardiovascular disease before any symptoms appear, before any diagnosis. SWAN Heart Study: 492 women, lower FMD. Women with hot flashes had lower flow-mediated dilation, a marker of endothelial dysfunction that predicts cardiovascular disease, independent of estrogen levels and standard risk factors. That last part is critical. Independent of estrogen levels and standard risk factors. Meaning, this was not just because their estrogen was lower. This was something the hot flashes themselves were associated with. The researchers found the same associations in younger midlife women, not just older women, and they also found higher aortic calcification in women with hot flashes. calcified plaques in the arterial walls, another early marker of cardiovascular disease. Aortic calcification is not something you feel. There is no symptom. It builds silently over years, and it is one of the most reliable predictors of future cardiovascular events. The SWAN Heart Study found more of it in women who had hot flashes. Not in all women, not automatically, but the association was there, and it was there in women who were still in the middle of their perimenopausal transition. Not postmenopause, not decades later, now. Here is something the research revealed in 2024 that most doctors still do not know. Not all hot flashes carry the same cardiovascular significance. The ones that happen during the second half of the night, roughly 2 a.m. to 6 a.m., are associated with a higher cardiovascular risk than the ones that happen during the first half of the night or during the day. Why? Because the second half of the night is when your body does most of its REM sleep. It is also when your heart rate, blood pressure, and inflammatory markers are in a specific physiological pattern that supports overnight cardiovascular recovery. When hot flashes disrupt this window, repeatedly, night after night, that recovery process gets interrupted. Menopause Society 2024. 59% of nocturnal hot flashes occur during the second half of the night, the window linked to the highest cardiovascular risk. This is the window your body uses for overnight vascular repair. Karen from Charlotte told me something that I hear from women constantly. She said, I wake up at 3 a.m. almost every night, soaking, heart pounding. I thought it was just the hot flash. She was not wrong, but she also was not getting the full picture. The 3 a.m. wake up is not random. It is your body going through a vascular event during the exact window when your heart is trying to recover. Here is the structural reason this connection is missed in almost every appointment. When you go to your gynecologist, they are looking at your hormonal health. They see hot flashes as a menopause symptom. They may offer hormone therapy or lifestyle advice. They are generally not ordering cardiovascular markers. When you go to your cardiologist, if you ever do, they are looking at your blood pressure, your cholesterol, your family history. They are generally not asking about your hot flash frequency. They may not even know you are perimenopausal. Two separate conversations, two separate specialists. And the connection between those two conversations, the research that links the symptom in one room to the risk in the other, has not made it into the standard appointment. This is not a failure of individual doctors. It is a gap in how women's cardiovascular health has historically been studied and treated. The American Heart Association published a scientific statement confirming that the menopause transition is a time of increasing heart disease risk. That statement exists. The research exists, the SWAN study exists, but the 15-minute appointment has not caught up to it yet, which is exactly why you are here and exactly why this matters. You know what I hear from women on this channel more than anything else? I thought I was the only one. The sleep changes, the exhaustion, the mood shifts, the anxiety, the brain fog, feeling completely unlike yourself without understanding why. After hearing the same story again and again from women in their 40s and 50s, I realized something. Women in this phase of life have been completely overlooked. That is why I started PrimalHer, something being built specifically for women navigating these hormonal and body changes, not another generic brand, something built from the inside out for this specific phase of life. If you go to primalher.com and join the waitlist, you will be one of the very first women to hear when we launch. 4 specific things, starting with the one most women never think to do. First, start tracking your hot flashes, not just whether they happen, but when. Specifically whether they are waking you up during the second half of the night. After 2 a.m., keep a simple log for 2 weeks. Day flashes, night flashes, what time, how severe. This data is something you can bring to your next appointment. And it is something that changes the conversation from I have hot flashes to I have frequent nocturnal hot flashes during the highest cardiovascular risk window. Those are two different conversations. Bring the data. Second, ask for specific cardiovascular markers at your next blood draw, not just standard cholesterol. Ask for CRP, C-reactive protein, a marker of vascular inflammation. Ask for fasting glucose and insulin, because insulin resistance accelerates endothelial dysfunction. Ask for homocysteine. Elevated levels are associated with arterial damage. And ask for blood pressure to be checked at the beginning of your appointment, not after you have been sitting in a stressful waiting room. These are not exotic tests, they are standard, but you often have to ask. Third, 3 specific things that the research shows directly support endothelial function in midlife women. Omega-3 fatty acids, specifically EPA and DHA, have been shown to improve flow-mediated dilation, the same measurement the SWAN study used, 2 grams per day from food or supplementation. Magnesium. Most women over 40 are deficient, and magnesium directly supports vascular tone and reduces the frequency of hot flashes in multiple studies. 300 to 400 milligrams daily, and resistance training, 2 to 3 sessions per week. Not cardio. Resistance training lowers cortisol, improves insulin sensitivity, and has been specifically shown to improve endothelial function in perimenopausal women. Fourth, and most important, walk into your next appointment and say this: I want to talk about my hot flash frequency in the context of my cardiovascular health. I understand there is a documented association between frequent vasomotor symptoms and endothelial function. I would like to assess my vascular health proactively. You do not need to memorize those words exactly, but you need to have that conversation. Because the research exists, the connection is real, and your appointment can include it if you bring it. Hot flashes are not just a nuisance. They are not just a symptom of menopause. They are your body producing a measurable, trackable cardiovascular signal, and most women are going through them without anyone explaining what that signal means. Now you know, and now you have 4 specific things you can do about it. Share this with someone you love, a sister, a friend, anyone who is going through this and does not know what their hot flashes are actually telling them. This is exactly the kind of information that should not stay in one inbox. Subscribe, 1 video every week, and leave me a comment. Have you ever had a doctor connect your hot flashes to your heart? Yes, no, or never even came up. I am reading every single one. And one last thing before you go. If you have been trying to figure out why your body suddenly feels different, why your energy disappeared, why your sleep changed, why your emotions feel heavier lately, you are not imagining it, and you are not alone. PrimalHer is being built for women exactly like you. The waitlist is small right now, and we want to keep it that way. The women joining now will be the first through the door when it launches. PrimalHer.com, the link is in the description.